Hello and welcome to our presentation. My name is Alexander, and today with my colleague Aitek, we will present the research we have done along with our colleagues Vagelis and Vasilis to explore the applicability of reinforcement learning toward the treatment of HIV patients. The contents of this presentation are the following. Firstly, we will give an overview of the problem we're trying to tackle, the strategies that have been used in the past to deal with it, and where reinforcement learning can be a good fit. A description of a novel algorithm called the Q-fitted algorithm used to generate the optimal medication strategies will be given, along with an overview of the equations that describe the evolution of the HIV virus in the human body and the equilibrium states described by them. Moreover, to train the algorithm, a set of quality data that represents the real world as accurately as possible is needed. Therefore, a novel procedure used in that regard will be presented. Finally, a list of directions for future research will be given, after which the presentation will be concluded. HIV. What is HIV? The human immunodeficiency virus, or HIV, is a retrovirus that once it enters the human organism, it infects the healthy cells of the immune system and interrupts their regular behavior, which could lead to the deadly acquired immune deficiency syndrome. Nowadays, the treatment of this condition consists of a cocktail of drugs to suppress its development given without interruptions. But practice has shown that long-term exposure to this type of treatment of highly potent and costly medications is associated with adverse effects such as drug resistance and mutation of the virus. One of the most promising strategies is the structured treatment interruption, in which patients during their treatment may change their medical diet and receive only one of the approved drugs or none of them. But to schedule this strategy optimally, an intelligent algorithm that can incorporate past data is needed, which naturally leads to the problem statement presented in the slide, and that is to search for optimal STI strategies for the treatment of HIV using reinforcement learning. And here is where the Q-fitted algorithm comes. This algorithm works by iteratively generating better and better approximations of the optimal medication strategy by solving a sequence of standard batch mode supervised learning problems with the extra tree algorithm, which is discussed more thoroughly in the paper. This, of course, is done to satisfy a certain cost function that aims to minimize the amount of virus particles in the body, represented by the first and last term in the formula showed on the slide, but also the cost of the treatment, which is represented by the second and third terms in the formula. Here it should be mentioned that these terms are also weighted, which means that their importance can be altered on a single patient basis. So, for example, for patients that experience severe effects to a specific type of drug, the weight associated with that drug can be increased and thus penalizing its use. As for the dynamics of HIV, they have been successfully described by a six-order state space representation. The equations for the system can be seen on the right. As for the states, they are firstly, the number of healthy lymphocytes, secondly, the number of healthy macrophages, the number of infected T lymphocytes, the number of infected macrophages, the number of free virus particles, and the number of HIV-specific cytotoxic cells. Now, what is more interesting than that, than the equations themselves, is that standard analysis can be performed on these equations to obtain some information about key properties of the dynamics of the system, namely the equilibrium points. The HIV dynamics are represented by three equilibrium points: the non-infected point, the infected but relatively healthy point, which is the target for any drug strategy, and the infected non-healthy point. The healthy point has a small basin of attraction, far smaller than the non-infected, and therefore any minor perturbation will drive the states to the non-healthy point. The goal is to obtain a narrow control strategy to drive the states from the non-healthy point to the healthy one. Now I'll give the word to my colleague Aitek, who will present the rest of the research and conclude the presentation.
Yes, thank you, Alex. Now I'll proceed with the data generation. To train the algorithm, the quality data that accurately represents the real-world phenomenon is needed. And one way to go about this is to gather data from real patients, but that process can be very time-consuming and expensive. Potentially millions of patients have to be followed. However, a more efficient method is to generate data numerically using evolutional equations explained earlier. Moreover, by using the Q-fitted algorithm and applying it during that process, the generated data can be made more realistic. And why is that? In reality, clinicians already have some information on which strategies are beneficial, and therefore applying schemes generated by the fitted iterations algorithm generates data that is closer to the real world scenario. And next up, we have some alternative methods, some new methods that could improve the method that is already implemented on reinforcement learning for HIV treatment. And that is online reinforcement learning, which requires no initial data and the model learns as it collects data. In the current offline reinforcement approach, it's also called the batch reinforcement learning. The model is already trained with a sufficient amount of data before it is used for decision making. The main advantage of online reinforcement learning is that it is a more dynamic approach, and the model itself adjusts to the input data more fluently. But however, the disadvantage is that initially there are some random actions taken before there are enough data that are gathered. So that also brings the risk of being stuck at early suboptimal solutions. And therefore, for this online reinforcement learning approach, the trade-off between exploration and exploitation, which are the two centerpieces of reinforcement learning, is critical. Exploration is mainly discovering new solutions, seeing if there could be other more optimal solutions rather than just being stuck at sort of a local optimal solution. And exploitation is basically just taking advantage of the current most optimal solution. So there has to be a trade-off in between these for online reinforcement learning to be effective. And next up, we have some recommendations. First of all, there needs to be better data in order to account for variation in dynamics. There are a lot of variations in dynamics in real life, as opposed to how we originally model. And transition from simulations to real life patients brings a few problems. There could be problems with the observability. There could be problems with the statement of the problem, as patients are different from each other, and the dynamics of the HIV actually changes from patient to patient, as opposed to how we sort of ideally model it. And for the new method that we suggested, the best approach is to combine both online and offline reinforcement learning. So that is sort of initializing the model with offline data as the model already is, and we have prior runs, and then we use the online reinforcement learning to fine-tune and get the policy to even better with tiny increments. So we kick off with offline reinforcement learning, that's how it's initialized, and then online reinforcement learning is used to sort of polish the solution. Finally, to wrap up, first of all, in this presentation, we described the Q-fitted algorithm, which is the mathematical background that we use for how reinforcement learning could be used in HIV treatment. And then we described the dynamics of HIV, which shows how HIV could be modeled in scientific terms, how we use it in a model, how we develop the algorithm, so we can find the solution for the ideal strategies to treat HIV. And then we show the equilibrium points of HIV, which show the key states, sort of what we desire to get in the end with this model, which states we want to go to and which states we want to avoid. Next up, we describe the data generation, as data is really critical for this case. We described how resembling real-world data could be difficult and which steps could be taken. And finally, we described some alternative methods, namely the online reinforcement learning, which could be the future of how reinforcement learning for HIV treatment could be further improved. In conclusion, the use of reinforcement learning for HIV treatment basically simulates numerically the patient trajectories from the HIV dynamic model and uses that to develop an optimal STI strategy, which could be produced using clinical data from both patients and simulations. However, it should be noted that there is still plenty of room for improvement. The differences between the patients, the mutations within the virus, and the availability of the data are the three key topics that the scientists are currently working on to further improve this model for using reinforcement learning to find the optimal STI strategy for HIV treatment. And thank you for listening to our presentation, and feel free to ask us if you have any questions.